Hi everyone. On the previous class, we discussed regarding the methods, what are the classifications under hospital oxygen administration. And in that first one, we already discussed like nasal cannula, we discussed. So today, I'm going to start with simple face mask. So in the picture itself, you can see the face mask. Okay, so here this is the face mask. With that, one connecting tube will be there, and one end of the tube will be connected to the mask, and one end of the tube will be connected to the oxygen cylinder or to the outlet. And here one strap also is there, that also you can see. So this is the parts of simple face mask. Here exhalation ports is there, and inlet, oxygen inlet is there. This you can see one strap also with the face mask. This is the parts of simple face. Now we have to know what are the procedure or what are the steps should be followed while applying or administering oxygen through simple face mask. First of all, for every procedure, we have to perform hand hygiene. Hand hygiene is very important. So go for hand washing and dry your hands, then put on gloves if it is available. Next is explain the procedure and the need of oxygen. So why explanation? Explaining the procedure to reduce the fear and anxiety of the patient regarding the procedure. And they should know what we are going to do, why we are going to do this. So third step is prepare the oxygen equipment. So we have to assemble all the equipments, articles needed for this procedure, and after that every very important equipment, oxygen cylinder, it may be oxygen cylinder or it may be wall outlet, the source will be different, and we have to prepare that equipment. So first of all, attach the humidifier to the wall outlet. So that humidifier, it should be filled 1/3 with the sterile water, and you have to attach that to the wall outlet um, with the flow meter. Next is connect the tubing from simple mask to the outlet on the humidifier. So in the humidifier, one outlet will be there. There we have to connect the one end of tubing, and the other end of tubing will be connected to the mask. And this next one, set the oxygen at the prescribed flow rate. So how much as prescribed by the doctor, that we have. Next, to apply the mask, guide the elastic strap over the top of the client's head. Bring the strap down to just below the client's ears. So we will be applying, so in the picture you can see that strap. That strap we will be applying on the over the top of the client's head. Then slowly we will be bringing down just below the client's ears. And next is gently but firmly pull the strap extension to the center the mask on to center the mask on the client's face with a tight seal. So we can make it tight. Their hole will be there. With that we can make it tight, and we can make sure that the mask is on the center of the face. So then we can little bit tight it so it will be fit appropriately. Make sure that the client is comfortable. Then after the procedure, remove the gloves and dispose it properly, appropriate container. Then go for wash your hands. So after that, the very important part of every procedure is documentation. So document the procedure and record the client's reactions. So as I said in the nasal cannula procedure, what are the things I told, like date, time, which method, what is the flow rate, everything response to the patient's response to oxygen, patient's conditions, respiratory condition, everything we will be recording in the patient's chart, and we will be sign in that chart, report to the senior staff for continuing the care or for confirming the patient's condition. Then check periodically for respiratory distress or any increased pulse. Check for any reddened pressure area under the strap. So if the strap is too tight, then there will be, there you can see, because of the pressure, there you can see red, okay, redness you can see. So you have to check everything properly while administering procedure, and each interval you have to go and check the patient's condition, whether the patient is comfortable or not. Then you have to, if if the doctor has said or ordered for discontinuation, discontinue the procedure, but it should be gradually. Next is, what is a nursing alert or nurse, what we have to see. The simple face mask is a low flow device, so that provide the oxygen concentration in 40 to 60 percentage in range with the flow rate or liter flow 6 to 10 liter per minute. But the simple mask require a minimum oxygen flow rate of 6 liter per minute to prevent the carbon dioxide buildup. Okay, so if the inhalation or the administration of oxygen is not according to the patient's need, the flow rate is, if the flow rate is not according to the patient need, then the expiration in the expiration there will be carbon dioxide will be there. Usually if the oxygen intake is less, then carbon dioxide buildup will be more. So to prevent that, if you are using simple face masks, there should be minimum oxygen flow rate 6 liter per minute. Okay, thank you.